Good evening, everyone. I'm Donna Bush. I'm so happy you could be here with us on our CIG television channels as well as live on Radio Cayman. We begin today's press briefing with a prayer from Pastor Winston Rose.
He who dwells in the secret place of the Most High shall abide under the shadow of the Almighty. Surely he shall deliver you from the snare of the fowler and from the perilous pestilence. Heavenly Father, we thank you for your favor and numerous blessings bestowed upon these islands. We thank you for your promise to hear us when we, your people, call upon you, and your promise to deliver us from the perilous pestilence. In response to your promises, we ask for your divine guidance and wisdom to be granted to all our government officials and to those persons responsible for the health care, wellness, and all other matters that are necessary for our well-being in these three islands. We petition you for this briefing today, that you will facilitate the clear communication of the information that is needed by all of us who live here. We pray for peace of mind for those who are anxious and fearful, and ask for your protection for all of us. Help each of us to play our part in doing what we're able to do to contribute to the suppression of the virus. We thank you for the success we have had to date. However, as we confront the latest challenges and as we contemplate entering this new phase in our national plan to open the country's borders, we pray for uncommon wisdom in our decision making. Father, help us that whatever is done will be both safe and gainful. We ask these mercies in the name of your Son and our Savior, Jesus Christ. Amen.
And thank you, Pastor Rose. We now welcome our panelists, His Excellency Governor Martin Roper, Premier the Honorable Wayne Panton, Minister for Education, the Honorable Juliana O'Connor Connolly, and Minister for Health, the Honorable Sabrina Turner. Also joining us in studio is the Chief Medical Officer, Dr. John Lee, some members of the media, senior civil servants, and the sign language interpreter. As well, some members of the media are joining us via Zoom. We go first to Dr. Lee.
Good evening, everybody. It's nice to be here in person. Unfortunately, it's not under as favorable circumstances as we would all like. I just wanted to give you a recap on the COVID outbreak that we previously reported last week that came to light Wednesday evening of last week. I've previously let you know about 3 community cases, and I'm pleased to say that the one person who is an inpatient as a result of that is doing well and is very stable. There are 2 others who are also stable and unchanged who are isolating at home. There is 1 additional case related to that now who became symptomatic in government approved quarantine facilities, and that is the additional positive COVID case. So we have a total of 4 related to that. A total of 35 direct contacts were isolated, and 48 people have been isolated, including the households related to that community outbreak. 80 people in all have been tested for COVID-19, and a further additional 40 screened over the weekend. So quite a bit of screening related to that case. You'll now also be very concerned to hear, and that's why we're having this press conference today, about the case that has been discovered at Georgetown Primary School. In addition to 1 symptomatic child who presented to the flu clinic, there have also been 2 further children identified as positive who are asymptomatic. This brings, sorry, I beg your pardon. We're also contact tracing 1 more individual who is positive, but this contact tracing only began around an hour ago, and so I don't have any further details other than to say there may be a connection here with Georgetown Primary School, but more details will come at a later time. So in all of the 45 people in Year 6 at Georgetown Primary School, we have resulted 28 of those, and 3 of those in total were positive. Across the islands, therefore, we have seven different households which have people who are positive for COVID-19 disease, and these people are in different geographical locations, and the exposure is not known to be common, and therefore we would say that our status as far as the World Health Organization is concerned is at community transmission at the lowest level of level 1. It is very reassuring to know that the progress of this child is good, the child is doing well. It's also reassuring to realize that our vaccinations are working, in that this essentially was going on without a lot of us knowing about it. I would like to reiterate that we'll follow the World Health Organization's guidance on contact tracing, and that only primary contacts of somebody who's positive will be asked to isolate it, and public health will give that advice and have given that advice directly to the people who need to do it, and nobody else needs to isolate. A direct contact would mean somebody living in the same household or somebody having immediate physical contact, such as a hug or a kiss, and then also we all know to be at less than 2 meters for more than 15 minutes with somebody. A lot of people have been tested as a result of the virtually open invitation at Georgetown Primary School that Public Health were able to achieve today, and I'm very grateful to the team for again springing into action, and I understand that they have swabbed over 600 people, and those results will gradually come in over the night until we get a much fuller picture tomorrow. That's really the end of my report about these about today's business, apart from to describe a little story. I mean, I've been in the United Kingdom now for the last 6 weeks, as many of you will have known, attending to a family matter. 6 weeks in a country where we know the Delta variant is quite widespread. And of course, I know about infection prevention and control, but I had my hair cut. Nobody was wearing masks when I had my hair cut. I went to the butcher's. I went to the baker's, I went to the supermarkets, I went to the pub, I went out to dinner with my friends, went to restaurants, and in most of these occasions when we were sitting talking, we weren't wearing masks. Every time I went to visit my parents, I did a lateral flow test the day before to make sure that I was okay before I went to visit them, and when I came back, I went into quarantine, and my PCR test was negative. So it is perfectly possible to lead a very good and full life in a country where there is COVID, provided that you're following the right rules to keep yourself safe. Thank you, Donna.
Thank you very much, Dr. Lee. We now go to the Honorable Premier, Mr. Wayne Panton.
Thank you very much, Donna, and thank you to everyone who has joined us this afternoon for this latest COVID update. Let me start by saying that this is obviously a very challenging time for the country, particularly for our people, our population who have not had to have these types of concerns for some time. But we knew that this day was going to come at some point where we do have COVID transmission in the community. We simply thought that it was going to be probably a month and a half from now, 2 months from now, rather than now. But here we are. I want to say, firstly, thank you to all of my colleagues, to the people from public health who have done an amazing job. We sort of reconvened late yesterday evening and went on into the wee hours of the morning. And they have worked very hard, done a fantastic job. They're reaching out to the parents of the school. My colleague, Minister Juliana, as the Education Minister, has done a great job with her team in terms of dealing with the parents of Georgetown Primary School, the teachers, the staff there. My colleague, Minister Turner, from her health perspective, has done an excellent job, and I want to thank HE, the Governor, for joining us again. I don't want to leave out anyone else, so let me say the program board as well has been an excellent source of advice, as they have always been, not just for this government, but for the former government as well. The collective effort that we are all seeking to put forward here is to manage our borders, manage this situation now to ensure the safety of our people, and in particular to do our best to ensure the safety of our children. We have a very high vaccination rate, but we need it. We know we need it to get higher, and as Dr. Lee has noted, we are clearly showing the benefits of the high level of vaccinations that we have. But we need to continue to push that, because, as we have said many times, that is the key to us, I feel, and it's entirely supported by the evidence and many of them in the medical community, that is the key to us being able to manage COVID in our community and provide safety for our children. So, as Dr. Lee noted, in terms of going by the WHO definition, we are in this low level of community transmission. But that, for us, at this point, effectively reflects, given that it is much earlier than anticipated, for us, I think it reflects a game changer. We have not had an opportunity, even though a lot of effort has been expended in terms of trying to engage with the public, educate people around the issues, get us out of this perspective that we have been in for some time, that we have complete safety. In order to move forward and reflecting the reality that someday this was going to be back, we needed to, and we need to have the time to be able to educate the people of the country and ensure that they understand all of the risks, what they have to do, and to work in the community and deal with their families and children. So this, for us at this point, is really a game changer. So, in terms of our plans, we are going to announce today that we are pausing phase 3 of our reopening plan for the rest of this year. We don't want to be rushing anything. We want to remain cautious and be able to carefully consider the various steps that we need to put in place to address the community spread, and to ensure that our people feel safe, and to ensure that our children are best protected. So we are imminently going to be making changes through regulations. Some of these changes include mandating masks in indoor areas, including churches, schools, supermarkets, bars, and insisting on the use of hand hygiene. Masks will not be required, obviously, for outdoor activities as long as the crowd limits are acknowledged. We will probably be reducing some of those crowd limits. We haven't completed the regulations, as I noted, but that will be imminent. We will probably be somewhere in the region of 100, a limit of 100 people for indoor events, and 250 people for outdoor events. In terms of other matters that we're seeking to change, obviously social distancing is an aspect of this. We will also be seeking to make a change specifically to the quarantine requirement. Currently, for vaccinated travelers, the quarantine requirement is 5 days. We're proposing to take that to 7 days. Effectively, then, there will be a 7-day quarantine period. The testing will be on day 8. Of course, the 10 days for those who are vaccinated but unverified will remain, and 14 days for those who are unvaccinated will remain as well. Now, you might ask why the change in terms of the quarantine period. Effectively, when this was first recommended to us as a proposal, there was a pre-flight PCR test requirement that would effectively have been done 2 days, maybe as much as 3 days ahead of the flight. Circumstances have changed. Technology has changed. Equipment has changed. Particularly at airports, for example, you can now get a PCR test in an hour before a flight. So that has effectively reduced the actual quarantine period from what we thought was some ways in around 7 or 8 days to really just 5 days. So instead of trying to change the pre-flight testing, we leave that as it is, and we just extend the quarantine period in Cayman by an extra 2 days. So that is the proposal there, which will be reflected in new regulations going forward. The geotagging will be re-implemented as well. We have had a number of reports over the past several weeks of quarantine breaches. In fact, we've seen some of those quarantine breaches being prosecuted this week. Based on the reports from the police, the indications are that they typically did not involve the traveler leaving the quarantine location, but rather others from the outside coming in to the quarantine location. So that may not, putting on the geotags, re-implementing the geotags may not have that much of an effect in relation to that scenario. But the fact is, we want to basically ensure that we do everything we can to minimize further risk. So even though there's not a lot of evidence to support putting it back in, we're going to put it back on to ensure that we take a belt and braces approach in respect of that. We, as you know, no unvaccinated tourists are allowed in the Cayman Islands. We will want to effectively limit those who can come in who are not vaccinated. If you're a Caymanian, of course, if you're a permanent resident, if you are a dependent on a work permit, then you can be unvaccinated. But other than that, we will slightly change the approach that has been taken in the past so that people who are unvaccinated are further restricted in terms of coming in to our country. We absolutely need to do this in order to continue to protect our older, vulnerable folks, as well as specifically our unvaccinated children. Of course, we urge those, on every occasion we do this, and I don't know how many different ways we can say it, how many different ways we can beg people to do it, but please, once again, go out and get vaccinated. This vaccine is safe, it's approved, and it works. You've heard Dr. Lee's opinion in terms of the vaccine, the fact that we have a significant vaccine distribution in the country, being responsible probably for this current outbreak of community transmission going unnoticed for some little time. The vaccines work. That's what they are designed to do. They will protect our older people. They will protect you. We need to put a vaccinated wall of safety around our children, Our children cannot get vaccinated at this point. We are very much hoping that in the coming months we will be able to have authorization and have the support of the United Kingdom in implementing a vaccine program for children. At the moment, we all know that that isn't possible. We need to have that solid wall of vaccinated people around our precious children to protect them. So please go out, get vaccinated. We are also planning on putting in security measures to protect our sister islands. I think there is absolutely a clear recognition that we have a lot of people in that community who are more vulnerable than the normal distribution demographically, and they obviously have less significant facilities there to be able to manage any difficulties. So we're proposing to put in place controls around that to further minimize the opportunity for any kind of community spread there. I want also the people of the country to know that while we have been taking an extremely diligent approach, and we've always reflected very carefully on the various components, the various factors that are relevant, that are of concern to our people, our parents, our mothers, fathers, even our children. I want you to know that we understand those the realities around that, and we are cognizant of those at all times. People probably know enough about me to know that I know, unfortunately, more than others, and thankfully that is a limited group in terms of company. But I know what it is to lose a child, and I want people to understand how much care and concern and how much diligence we reflect in everything we do in trying to ensure that our people are safe and our children are as safe as possible. This is not about economics. I don't want to see any comments about, this reopening plans or about greed or anything like that. It's not about that at all. It's about a recognition that we don't know how long this is going to go on, and the government has a responsibility to the country to plan for a future which might include, for some time, having to live with a virus, live with a disease that we need to manage. And we're not going to learn how to manage it by keeping the borders closed. And it definitely isn't about politics either. I have no interest in interjecting politics in any of this. This is about our people. This is about our country. This is about the success of our country. This is about our families. This is about our children. This is about success for all of us. We will get through this together, ladies and gentlemen. We will get through this together. I want you to understand that and have the confidence that we will get through this together. I also want to say, lastly, that it does not help us at all to have the speculation going on social media, the comments, the unnecessary spreading of rumors, the creation of the rumors, the spreading of the rumors. These, at times like this, cause far greater pain and unnecessary distress for businesses, for individuals, for parents, for children. This is all unnecessary. So please, ladies and gentlemen, refrain from creating this sort of stuff, refrain from distributing this sort of stuff, because it adds nothing. It is, trust me, at the end of the day, it's not of any entertainment value at all. It only causes pain and distress to our families and our people. It is unnecessary, so please don't do it. I think at that point I will say thank you very much, and I will let the rest of my colleagues speak. But I want to say God bless our Cayman Islands, and as I said before, together we will get through this, and thank you very much.
Thank you very much, Honorable Premier. Before we go to His Excellency, I would like to make an appeal to the Cayman public to encourage each and every one of you to go and get your vaccine if you're able to. I was hesitant for quite some time, and I decided to go for it last week, Thursday, and was accompanied by our Honorable Premier. If you're able to get the vaccine, I appeal to you to please go and be a part of the solution and not a part of the problem.
Thank you, Donna.
Your Excellency?
No, thank you very much as well, Donna. Thank you very much. Let me first of all just thank the Premier. He thanks everybody else, but Premier, I want to thank you for everything you're doing at this incredibly difficult time. And I know you and I work very close together, and I know just what an incredibly caring, considerate human being you are, and you are putting in a huge effort, as all of your colleagues are, to handling this pandemic. I do recognise it's a time of stress and anxiety for everyone in our community. We've had an incredibly safe bubble for 18 months, and it doesn't quite feel like that just now. But we should remain calm, and I do believe we can take great comfort from the fact that our vaccination rates give us a lot of protection, one of the highest rates anywhere in the world. And we still only have a small number of cases of community spread. It's self-assigned that, as the Premier said, the vaccines are doing their job, though we should be ready for this to go up as testing and tracing continues. But we're a long way from having to go into any kind of lockdown. As the Premier also said earlier today, that isn't necessary. But we do need to learn to live with COVID. As we have repeatedly said in these press conferences, it is not going away, and especially because Delta is just so infectious. That is really a game changer in this global pandemic, and why this is happening to us at the moment. I know it is even more upsetting for everyone in the community to hear that children have tested positive for COVID. It must be an especially worrying time for their families. The global COVID experts working for Public Health England spoke at length yesterday to Cabinet and the Premier's caucus about many issues relating to the pandemic. And they did reassure us, as Dr. Lee has also, that when children become affected, they generally get a much less severe disease than can affect adults. And I very much hope that the small number of children so far affected and anyone else recently affected recovers swiftly. This week's events have therefore proven that COVID is here in Cayman. Dr. Lee confirmed 7 different households affected by community spread. And so far, we're not able to say categorically if it has got into the community through a quarantine breach or in some other way. I am well aware, because of my responsibilities under the Constitution, that we do have some people involved in illegal activity arriving on our shores after undeclared boat trips to and from Jamaica. We do not know if that is a source of this breach, but it is one possibility. But notwithstanding all of that, quarantine should not be treated lightly. Whilst we still have these protective measures in place, everyone must adhere to the rules. Please do not leave your place of quarantine. Do not have visitors while in quarantine, and make sure you receive deliveries in a COVID-safe, contactless way. Read the instructions you are given before your quarantine starts and follow them very carefully. Every one of us needs to assume responsibility for the welfare of our community. Otherwise, you are likely to be prosecuted. The recent cases of community transmission have encouraged more people to take the vaccine to protect themselves, and that is very welcome. As I said earlier, our vaccine rates are very high, now at over 75% of the population. 81% of the eligible population are fully vaccinated. But like the Premier, I urge more to come forward, particularly our younger people, those between 12 and 18 and under 30s. We need more in those groups to come forward to get the vaccine. If every eligible age group was at 80% coverage, this would give us the very best chance of stopping COVID in its tracks. This is called the firebreak effect. And even for new variants, a high percentage of vaccine uptake will give us a very strong firebreak effect. So please do continue to come forward. I know some people have been asking, and I've had calls in my office about this, why we cannot offer the Sinopharm vaccine in Cayman. We asked the Public Health England experts that direct question yesterday, and they told us that the manufacturers have not asked for UK approval for that vaccine, so it has no license in the UK. Therefore, the UK would have no plans to send that vaccine to us. On boosters, we heard that the UK today approved a booster programme for over 50s and that Pfizer is the vaccine of choice for that programme because it is well tolerated and it has a very good effect. We have ordered booster shots today for all relevant age groups in Cayman, and we're waiting to hear when they arrive. But I do expect we will be able to start our booster programme very soon, which is very good news. Now, I know that government has not taken this decision today to postpone, taken the decision lightly to postpone the removal of quarantine for vaccinated travellers on the 14th of October. Public Health England advice yesterday was that we are in a strong place if we decide to go further in our reopening. But they did say that we do need to consider three things very carefully before doing so. One, our health system must be very well equipped to respond to any cases of community transmission. And while the recent cases this last week were an incredibly useful test run of our systems, they did show that they could benefit from additional resourcing. Two, higher vaccination rates among the under 30s would really help ensure these effective firebreaks I mentioned. And three, infection rates in feeder countries need to be considered in any policy response. So there are, as the Premier said, a number of areas now requiring further work, including lengthening the 5-day quarantine to 7 days, the electronic tagging. We have to reduce the number of positive cases that are coming into our islands through further restrictive travel measures. And I do want to add my voice to what the Premier said about misinformation. I've seen a credible amount of that this afternoon, and it really is unhelpful. So please do get your information from official sources, and please do not spread misinformation on social media because it causes so much alarm, upset, and anguish to many people. So I just want to say that I fully support the decisions that the Premier has announced today. The situation is under control, and our health teams from Dr. Lee, HSA downwards, are doing an incredible job under enormous pressure. I've been greatly impressed since arriving in these islands by the resilience that everyone here has shown, and I am confident that we will meet these latest challenges with confidence and resolve. Thank you, Donna.
Thank you very much, Your Excellency. We now go to the Minister for Health, the Honourable Sabrina Turner.
Good evening, everyone, and thank you, Donna. Today marks a day that I'm quite sure, sitting here in this seat amongst my colleagues and working into the wee hours of the morning, came with a lot to consider. As a mother, as a wife, as an aunt, I can only imagine the anxiousness and nervous many households right now are facing. And I can assure you that as confident as we are, as poised and as controlled as you see us, this is not an act. Because what we are embarking on and what we are experiencing right now is reality. But what we are humbly asking each and every one of you to do this evening is to take this serious and to let you know that without your cooperation, without your assistance, without you following the protocols and showing that you can be a catalyst of change, that you can help us fight this fight, that there is no playbook. No one has the playbook to refer to in order for us to contain, to manage, and here we are again this evening, wholeheartedly appealing to each and every one of you who is eligible to get vaccinated to go and get vaccinated. On this note, I know that the ladies and gentlemen of the public health staff especially has been under significant pressure, but within our very nature, within our very DNA, in choosing that occupation of choice, we got it. We are ready. And because of that, to give you some information, January of 2020, there were 69 staff in the public health department. In January of 2021, that was increased to 72. In September of this year, it is now 83. And we're seeking to deploy and give an additional 30 persons in order to assist in that department so that we will have sufficient resources on hand in order to fight this fight. While much has been made in areas to which people may not have been cooperating with us and thinking of the public good, such as in observing the quarantine regulations alike, there has been a huge positive public response in going to get vaccinated. Just today, currently at Cayman Bay, where there's an active vaccination clinic going on, there's a total of 195 persons that availed themselves to the vaccine, 159 of which was first dose, and second doses was 36 second doses. I want to appeal to each person to continue to go ahead and take this vaccine once you're eligible to do so. I have to thank and congratulate and indeed celebrate for all of those who are responding and assisting us in our fight. But we also have to continue in the adjustment of our behavior in order to get ahead of this. We have seen huge, from Saturday being out on the road, myself, I am so pleased for persons in our community for being proactive, and definitely I've seen an increase in number in persons from Saturday wearing of mask. I've seen corporate Cayman step up to the plate and have hand sanitizing station. And I'm also going to ask all of our corporate persons to aid and making or considering even implementing contactless approach when it comes to debit card transactions in aiding and helping us in this fight and definitely lowering and lessening the transmission points. Cayman, I'd like to remind you that the best way and the most effective way to prevent the spread of this disease is to exercise, again, facial covering, frequent hand washing techniques, cough and sneeze in a tissue, stay home as much as possible, and exercise practicing social distancing. Please note and understand that businesses, it's in the regulations, may require and can mandate that all persons entering their place of business must have a form of facial covering. I want to also encourage all persons that for anyone who is experiencing any symptoms whatsoever of flu-like symptoms, that we're asking you to stay at home. Or alternatively, you can contact the 24-hour flu hotline or your general practitioner, and you can call 1-800-534-8600, 947-3077, 925-6327, or you can email flu@hsa.ky. Amongst all of this, I'm asking each and every one to stay calm, practice preventative measures. For all of those parents who have been now placed in quarantine or isolation for 14 days, this too shall pass. It is out of abundance of caution, but we also want to keep at the forefront and the importance of how important it is to have a healthy mental health. This is something that I do not take lightly, as my position allows me to look at this 360. And to help you manage, I'll quickly just give you 6 to 7 quick tips. try to maintain perspective. Find a healthy balance in relation to media coverage. Ensure you have access to good quality information. Have conversations with your children and young people about COVID-19. Families and caregivers of children and young people should discuss news of the virus with those in their care and in an open, frank, honest way. Try your best to relate facts without causing alarm and in a way that is appropriate for the children's age group and their temperament. It is vitally important to listen to any questions that your children may have. Let them know that they are safe and that it's normal for them to feel concern. We all share that. There's no age factor that goes with that. If you find that the media or the news is getting too much for them, then encourage them to limit their exposure. Try to maintain practical and a calm approach. Try not to make assumptions, and don't be afraid to seek support. It can also help to stay in touch with friends and family, eat a balanced diet, and stay physically active. Try to sleep well and avoid the abuse of alcohol, tobacco, and illicit drugs. Acknowledge feelings of distress and seek further professional support if required. If you are currently being treated for a mental health condition, it is critical that you stay on your treatment where possible. Stay in contact with your healthcare professional, counselor, and support groups. Overall, please remember that part of staying safe includes taking care, again, of our mental health. If you feel worried or overwhelmed, there's many of resources available, and the mental health hotline is 1-800-534-6463, and it's open Monday to Friday from 9 a.m. to 5 p.m. Finally, I must repeat that our best protective and preventative measure is to being vaccinated against COVID-19. Having this protection for yourself and for your eligible loved ones will surely give you the greatest peace of mind possible in these unsettling times. We're so incredibly fortunate here in the Cayman Islands to have COVID-19 vaccine so easily available. And if you're not vaccinated, again, please get vaccinated as soon as you can. Please remember that we are all working together for the health and safety of our people and our home. This is no time to play politics. This is no time to spread malicious rumors. This is no time to give anything that is not factual. Stay safe, Cayman. God bless.
Thank you very much, Minister for Health, the Honorable Sabrina Turner. We now go to Minister for Education, the Honorable Juliana O'Connor-Connolly.
Thank you, Donna. Good afternoon to all the distinguished panelists. Dr. Lee has kindly conveyed the facts as they obtained to the Georgetown Primary School. Once we got the information last night, our team in the ministry, together with our colleagues, went into full gear to ensure that the proper protocols were put in place. And I certainly didn't hesitate to make the decision to close down the school because the safety of our children is always of paramount consideration. You have gotten the reports from Dr. Lee as to where they have reached with the level of testing. I also want to go on record to thank Public Health for the sterling job that they did, not only today, but I have every confidence that they will continue to do, as you've indicated by the Honourable Premier and my other colleagues here, that COVID is in the world to stay. So, tomorrow there'll be no school at Georgetown again because we're going to ensure that it's properly sanitized, that the testing continues, and that we can make our decisions from an informed
position based on the science and indeed empirical evidence. So what then do I require of Cayman? I require that we continue to be resilient, as we have proven to have been over the various hundreds of years. We've seen that in natural disasters, we've seen that in economic downturns, we've seen that in pressures from the global financial forum, and now we have COVID. But this one thing I know, that the God who have delivered us before is more than able to deliver us again. And it has come to pass. We ought not panic, because knowledge empowers. We have an excellent team. And despite what the naysayers say, politics being what it is, I just ignore the politics, because I set my course, even as Christopher Columbus did. Sometimes we may not know the new worlds and the new frontiers and the new boundaries that we're going to discover, but when you set your goal and you have your plans in place, as we have done in the education ministry, last year when this happened, we had a recovery plan, we moved to remote learning. Today, we had to work some long hours last night and into the morning, but because our goal and our objective is to keep our children, my children, safe within the educational institution environment, we were able to release an updated version of guidelines, not just our public schools, because I do have responsibility for the private schools as well, to the private schools, and that should go on our website and our social media later on tonight for the benefit of the press who may wish to access it. And it's an evolving document because of the evolving fashion that COVID has. We just cannot etch it in stone. So do not get deterred when you hear that this one isn't ready, the next one isn't ready. What do I require of you is to be ready. How can you be ready? By getting your vaccination. My children in the school has not legally been approved to get their vaccinations. So what can you do? As adults from 12 and over, go and get your vaccinations. We heard the increase in public health staff, and we will continue to increase, even though recruiting is difficult, because every country is going through this. But guess what? Because of you listening to the science, because of you adhering to your good Caymanian common sense, we still have not reached where we want to reach with tertiary education, because it's a journey. But one thing I know, the mariners of yesterday, our forefathers and foremothers, they were able to sail the high seas and became the envy of the world. The late Russell Johnson, back in the 60s, when we had to diversify our economy, came up with innovative financial principles that, although we have less than 100,000 people, the great G7s of the world look at Cayman and see us as a threat because of our success. There is an opportunity, Cayman, to leave a very indelible mark on our history. If we show the world that we're small, but we're Talawa, you Jamaicans can interpret that when you go home tonight with your children. We can show them, not through smugness or arrogance, but we are determined to live with whatever comes our way. We come from the philosophy, you see, Cayman, that when we get lemons, we can use them in many, many different fashions. But as a good Caribbean person, you throw a little sugar in some water and make some good swanky or lemonade. Let us take this opportunity of COVID and teach our neighbors that as Caymanians, Caymanian kind is not a byword for tourism, but Caymanian kind is a way of life for every single person in this jurisdiction. So what can you do? You can also wear masks. And I know we have a lot of machoism in the Caribbean, but wearing masks, if I could break it down and perhaps go back in my teacher mode, if you had two persons standing within that personal space, let's for the sake of this conversation say 2 feet apart, and neither of those persons had on a mask. And because we're human beings, we sneeze from time to time. And hopefully you didn't have a flu, but that's becoming more possible with the flu season that we're now so embarking thereon. If neither person had a mask and you sneeze, on the balance of probabilities, you would be the recipient of some of that body fluid. If you took care of yourself and you had a mask and the other person did not have a mask and they sneeze, chances are, on the balance of probabilities, some of it would land on the outer covering of your mask. If the other person did what we're asking you to do, take personal responsibility and wear a mask, where both persons, if you go down this imagery with me, had on a mask, the most that would happen is that the person who sneezed kept it within their mask. Get the picture? Go mask up, Cayman. That is what I'm requiring of you to do. Yes, there are children who are under 5, and it's difficulty. We have a fairly high percentage of SEN students within our populace. Go through with them, show them how to mask up, how to take it off, so that they won't be afraid. And I just want to say, what do I require of you? I require of you to test positive for faith, to keep your distance from doubt, which is inclusive but not limited to the garbage we see on social media and the innuendos and the implications that are there. What do I require of you? To isolate yourself from fear. How do you do that? By being soundly grounded in the Lord Jesus Christ. And I come back to that again, because if we don't have a root and a foundation, our optimism results in diminishing returns. But for those of us who've tested and tried, and our testimonies that he woke us up this morning and he blessed us with another day in one of the most wonderful places in this entire world, we owe it, Cayman, to our children and our students to get masked up, to adhere to social distances, to make sure that we've practiced proper hygiene. We have done, and we are continue to do, everything within our possibilities as a government. Unless you make a mistake, these persons here, those persons there in the government are all human beings. They get tired, they have feelings, they have families, they have responsibilities. And while they're trying to do what you elect them to do, to protect all of the people in these islands, regardless from whence you came, regardless how you look, regardless of what color you are, regardless of what social and economic demographics you come from. Again, I repeat, out of many, we are one people. Mask up, Cayman, for the good of Cayman. What do I require of you? Be Caymanian, be human, exercise Caymankind, because my children deserve to be protected, and I expect no less of you. I thank you for the opportunity to so express my feelings today.
Thank you very much, Minister O'Connor-Connolly. I would like to apologize for the technical difficulties that we're experiencing at this moment. We're going to go to a short break so that we can reloop everything and be back with you in just a bit. And welcome back to today's press briefing. When we left a short while ago, we heard last from Minister for Education, the Honourable Juliana O'Connor-Connolly. Now we're going to go to members of the media with their questions for members of the panel and Dr. Lee, beginning with Ralph Lewis from the Caymanian Times.
Thank you, Donna. And I have first 2 questions for Dr. Lee. If you could come, please. Welcome back into the studio, Dr. Lee. Can you say what are the total positives for today, if you have those figures?
My piece of paper is over there. Thank you. So we only have the positives that I previously reported to you in the outbreak, which is therefore an additional 2 asymptomatic children and 1 adult who's under investigation. We have had 447 PCR tests done overall, but those were the only positives to report.
And it is clear that we'll be doing a number of future PCR tests. How are your stocks looking at this time?
I've had no complaints of supplies from the Health Services Authority. I think also additionally, I previously mentioned, but we are likely, in order to extend the range of testing we're going to be able to do, to be sourcing lateral flow tests that have gone through sensitivity and specificity assessment by Public Health England, so that we can roll much wider testing out to both government and private establishments.
So there will be no problem in the future with delays of supplies in order to do all the testing that we could do.
I can never say that absolutely, but we don't currently have supply issues, and certainly, for example, from the lateral flow, we've been quite clear in asking Crown agents for their assistance to supply, to make sure that they do not foresee any supply issues with the ones that we choose.
And regarding the contact trace that we're doing with the first incident last week, Wednesday, have you gotten closer to the results or to find where the source of that first contact came from?
We have not got an absolute answer for that, no. Whether it's because the original source is now no longer infectious, we've not been able to discover, or we can't discover that source because somebody has not provided a link to that person. I think it's very important to say about the contact tracing, though, that contact tracing, to reiterate, that the only people that we will pursue are those primary contacts, and those primary contacts are those who have had intimate and close contact with somebody. People who are contacts of contacts are not subject to the same degree of investigation. It's only once you're an immediate contact that we wish to track those people down.
So we may find a situation where we never find out where that source came from.
Correct. I think you may be interested to know that we have done some further investigations about the genomic sequencing of that individual strain of Delta that was discovered. And we have some links to potential other strains which are very similar on Ireland, and we're looking into those links to see if there's any connection, but that investigation is ongoing.
Okay, thank you. Donna, thank you very much, Dr. Lee. My next question is for the Premier. Good afternoon, sir. Good afternoon. You mentioned that we'll be pausing phase 3. Are we going to be returning to phase 2, or will be adjusted phase 3?
No, at the moment we're in phase 3, which effectively means that only vaccinated visitors could come to the country. We are in the open skies arena, but at this point we don't have any airlines seeking to fly in, any additional airlines seeking to fly in, because presumably we are maintaining the quarantine requirement. So we're not going to move forward at this point to phase 4, which would have occurred on October 14th, and that would have in accordance with the plan, meant the removal of the quarantine requirements. Yes. I think, given where we're at, the issues that we have right now, the level of concern and anxiety in the community, our community, our people, our country isn't ready to move forward. So we're pausing it. We're pausing phase 3. We're not moving on to phase 4 for the rest of the year.
For the rest of the year, very well. There's a few more questions. It appears that the cause of the infections from the COVID may have come from breaches in quarantine. And if that is so, are you looking at changing the protocols around quarantine? For example, incoming visitors will have to quarantine in a government facility, or they can still self-isolate?
Well, as I noted earlier, we are going to re-implement the geotagging. We also have considered whether we can have just utilize the government facilities. And there has been an expression from the program board that may pose some difficulties with volumes. Now, if the volumes start to moderate and we can accommodate that may be an option. Because I think one of the real concerns we have is the possibility that, and as I mentioned, the evidence that we have doesn't suggest that people have been going out of the quarantine facility, but rather people going in,
Yes.
and then so non-quarantine people visiting and going back out. So that would certainly address that if we could house those in a government facility. But the feeling at the moment is that may pose some difficulties. I think the governor, His Excellency, alluded to the possibility that this may have come from an external source as well.
Yes.
That is not something that we can exclude, because we have not been able to identify exactly where this came from. But given that possibility and the all of the various reports that we have received and the police have received that they're investigating, there is a very high possibility that somewhere along the way there was a breach, either illegal entry into the country or breach of the quarantine rules, which may have led to this.
Okay. The opposition has been reaching out and making suggestions. And what words of comfort can you give to the opposition and to the community as a whole that you really have it in hand?
Well, I appreciate the opposition's efforts, but we have the technical folks, all of the public health folks. We have the program board. This is the same program board that would have advised the previous government, and now the opposition. And just like they had confidence in them, we have confidence in them, and we have confidence in our own government to be able to make decisions that are in the best interest of the country. Make no mistake, there is no playbook for this. We know many countries have tried to reopen and have had lots of issues. We have publicly acknowledged in the past, and I have done this multiple times, that we are going to be trying to do what other countries have not succeeded in doing. So it's not easy. The easy part was probably locking down. The hardest part is trying to unlock and deal with these issues. I think the country can take confidence and comfort from the fact that we are well advised by a great internal and public health body, the same one that led us for the last 18 months and advised the government, and the same one that's here today telling us and giving us advice and recommendations. So they can take a lot of comfort from that. The opposition themselves ought to know full well. They relied on them, so unless they can come along and show that we are ignoring the good recommendations and advice from these amazing people, I think they have nothing to worry about. I mean, yes, we all share the concerns about what's happening in the community. There's no question about that. But that is where I think the issues will end between us. They're trying to be an opposition, and that's what they do. That's what I personally would rather not have politics being introduced at this point. I think in the past, the previous opposition, I believe, was very supportive. I'm not saying that their comments and their suggestions are not worthy of consideration. In fact, they would know as well as anybody else what recommendations might be offered by the same body that has been advising us.
Thank you. I just have two more questions. I mean, very brief. The extension of the phase will definitely put some strain on the government's finances. And maybe in the next meeting, you can probably invite the Minister of Finance to come and give us an update on where the country's finances are, so we can get a better understanding of how we're going to manage it and see if we're in a position to really take care of our expenses as we go forward.
Yes.
And
Well, as I indicated, I think 1 or 2 press briefings ago, I've lost track. We've had so many in the last week, but we are assessing the various cost impacts and the economic positions, the economic impacts of this sort of action, just in case this very scenario sort of developed. So yes, we can have the Deputy Premier and Minister of Finance. I'm sure he will be happy to be here addressing those questions.
And the last question is about communication. I've heard everyone speak about the misinformation and the information on social media. And as a media owner, I understand too seriously how important that is. I believe that the success of managing the pandemic and moving forward depends on how information is passed on. And so what I would recommend is that maybe you have a meeting with the media houses, just sit down with us, so we can hear from you and get some advice and give some feedback as to how we can do our part to make it better. Because information is so critical, especially now, and we don't have the time to make mistakes or to confuse our people. And so I just want to ask you to maybe ask one of your staff to organize a meeting with us so we can sit down together, give you our concerns, and you can give some advice on your wishes.
Sure, absolutely happy to do that, and thank you for taking such a constructive approach on that issue. Clearly, we all have to work together to ensure that we can successfully navigate these choppy waters that we're in at the moment. So thank you very much.
Okay. Thank you.
We'll be
Thank you,
reaching
Donna.
out to you.
Thank you, Donna. That's all.
Thank you very much, Ralph. Before we go to media on Zoom, we're going to call on Angel Harris from the Compass.
I think I'm 6 feet away from most persons, so I'll remove the mask. Plus, I speak softly, as we all know. My first set of questions are to Dr. Lee. I might have missed this, but Dr. Lee, can you, well, welcome back.
Thank you.
What are the current vaccination totals to date?
I haven't got vaccination on this report. The only ones I have are a little bit older. I know that there have been further vaccinations today of around 200, but I don't have an exact count. We will have reached 76%, I am sure, when I give the final report tomorrow, because I was anticipating to reach that today.
Oh, okay. All right. And to you, Dr. Lee, what role, if any, do you believe the 5-day quarantine period might have caused in helping to result in a community outbreak?
I think there was always a risk that shortening, as we move forward in the reopening, of which moving down to a 5-day quarantine period was one of those things. But I was actually reassured up until this point that we'd lasted for so long with no obvious escape. I think it only goes to show how infectious Delta is, that it's probably it might well only be one case that's caused this when we investigated at the school. But it's just so infectious that this is what's happened. I think I want to go back to reiterate what I've said previously. We have screened hundreds, if not thousands, of people every week for the last few weeks, every single week. All of those results, those negative results that I report to you, I'm not talking about the exit ones. I'm talking about the ones that are not positive exits. And a lot of those results are for travel, people going to travel. So exactly the same people that are actually coming back and bringing COVID back when they are positive for exits are the same ones that went out and were negative when they went out, and we knew that because we tested them. So we have months and months of data where we know that it's been negative right across the community, and this doesn't include the screening around the ports and healthcare that we've also been doing. So it seems that it's quite temporarily, it's quite focused on recent rather than past. We also know it's recent rather than past because a lot of the values are very high. The viral counts are very high. The CT values are very low. which indicates it's a recent event.
As far as the sick child is concerned, was the child, the year 6 student, symptomatic? And what's the update on the child now?
Yeah, child is fine, doing well. The child was symptomatic, which is why the child was taken to the flu clinic to be tested, and that's where the positive came out.
Thank you, Doctor.
Thank you.
Premier Panton.
Yes, sir.
First question, obviously, is in light of the announcement of the pausing of Phase 3, do you not fear that this will serve as an incentive for people to not take up the vaccine?
No. I don't have I don't have that fear. We have COVID in our society right now. If that is not enough of a motivation for them to go out and get vaccinated, I have no idea what will be. I don't think that this is going to demotivate them or stop them from seeking to go and get vaccinated right now.
Okay.
They need to go and get vaccinated because this is the tool that is going to help us succeed as a country.
So what about the fact that the Phase 4 has now been pushed off for the rest of the year? Do you not fear that will also serve as a demotivator? If people now believe the borders will remain closed, what's the incentive for them to rush to get the vaccine?
Well, we have replaced one incentive with another. The fact is, we were going to, I mean, I don't mean to put it in that way, but the fact is that what Phase 4 meant and what we have always said was that COVID was going to be back in our community. And that you will recall, we were basically begging people, giving them the timeline as to when. It was September 9th, you have to get your first shot, then you get your second shot, then you have 2 weeks, you'll have developed full immunity by the 14th. That was something that we were begging people to do in anticipation that we were going to possibly have COVID in the community. Now we do. It has happened a lot sooner than anticipated. It clearly seems to have happened because of breaches of the quarantine rules. But however it happened, this is surely the best motivator to get people to go out and get vaccinated.
All right, thank you, Premier. Minister Turner, in light of the announcement, first, when are the new regulations expected to come into effect?
In the coming days, but bearing in mind we are dealing with this pretty much, as I stated in the opening, there is no playbook to this, and we adjust accordingly. But we have to be cognizant that when we're talking about crowd control, we have the supermarkets, the churches, we have so much other things to bear in mind that a number of preparation has to be given. But we are right now, out of abundance of caution, seriously encouraging everyone to do their part in wearing their masks, practicing social distancing, and definitely adhering to hand washing techniques until the new regulations come into play or any amendments thereof that is required. There's a set that's expiring tomorrow that has been extended. More PR to that regard will be going out. And from there, as we've known how we've navigated these uncharted territories, waters, and has gotten us here safely with rigorous public health regulations, we will continue to operate in that fashion, but cognizant that we have to give certain sectors advance notice as well.
In light of the announcement that the quarantine period will go up from 5 days to 7, how will that affect people who are already currently in quarantine?
All of those will be actually addressed as well with the implementation thereof. This is constant dialogue because we are aware of all of those. I mean, even inbound passengers, all of those persons who have already gotten approval from Travel Cayman, all of those matters has to be taken in consideration. But bearing in mind now that the dynamics of our community has changed, we do expect the cooperation of the greater public And that is in the best way we can navigate this going forward. But implementation and the safety of our people is key and is a top priority for us.
Thank you. I do have a couple more quick questions. Premier Panton,
Yes,
in light of the fact that the borders are now closing, is your government ready and or willing to prepare or provide financial supports and or bailouts to the companies that will be hit hardest in light of the remaining closure of the borders?
Okay, so we certainly anticipated the possibility that we may be in a position where we wouldn't be able to go forward with phase 4. So yes, we have considered the position. We made provisions to continue the level of support for some period of time. I said until the end of the year. I think we're perfectly comfortable in terms of the provisions we've made for that scenario. I know that we may have to look again at some of the broader pictures in terms of impacts on businesses. But those are things that I think that we are willing to have a look at. We know there may be some additional costs for the country and for the government, but we would prefer to do that and have our people settle down and make sure that we are protecting the people overall. We're enacting the best interests of the country and our people.
All right, thank you, Premier Panton. Minister Juliana O'Connor-Connolly, how long do you anticipate the school will remain closed for, Georgetown Primary?
For now, I can say with confidence tomorrow, but theoretically speaking, until Dr. Lee tells me it's safe to go back, I will not send my children back. And thankfully, we have computers and teachers who are computer literate that we can go to remote learning seamlessly.
And when last was the school properly cleaned?
Today.
And the buses, all today. My final set of questions is to Minister Bryan, who thankfully is in the room with us.
Mm-hmm.
If you're prepared.
Minister Bryan, the Premier just literally said that there are no airlines planning to come in as a result of the quarantine. Have the discussions fallen apart? Have they pulled out?
No, I think he was alluding to the fact that there's not many people who are going to have a lot of confidence until we withdrew the quarantining. That was the indicators we were getting from most of the airlines. Obviously, as Minister now, I'll have to have some discussions with them in light of our new changes. But again, its top priority is safety. So consider this just a push down further. If we can get things under control and the confidence of the people, and they are ready to do this maybe in January, I'm quite sure the airlines will be happy and excited to do it in January. But I suspect there'll be some changes. I'm quite sure I can give you an update in the coming days.
Final question. Is Ms. Cayman cancelled?
No, it's not. And everybody seems to be interested in Ms. Cayman, so that means it's going to be a good pageant. Actually, they're going to do it virtually in light of the restrictions that were advised to us until further notice. We're asking that it being indoor, that it be masked, and it's limited to 100 persons. So that means only the exclusive individuals like the parents and the committee members and so forth. So for those who were excited to watch it, get some popcorn, get some dinner, a glass of wine, and sit at home and watch it via social media. It's still going to be amazingly exciting, I promise.
All right. Thank you.
Okay, thank you, Andrell. I do have a couple of quick questions from members of the public as well as from John from Real Cayman News before we go to the media on Zoom. The first question is, I think it would be for you, Premier Panton, is asking, this is from John at Real Cayman News, if you were expecting community transmission of COVID, why not push on the current measures, which is change in isolation from 5 to 7 days and reopen the tourism economy anyway?
Sorry, you're going to have to back up.
If we were expecting a community transmission of COVID and we've now moved to the 5 to 7 days quarantine, why not reopen the tourism industry anyway?
Well, I think I've made it clear that there's a lot of concern in our community at the moment, and the timing certainly wasn't something that we were planning to do. We certainly wanted a further opportunity to help to develop and prepare our country and our society for facing the eventuality of managing this. We also wanted some additional time to help to push through on the vaccinations. In addition, I think, as His Excellency mentioned earlier, we were hoping that the timing would work out in relation to the booster shots, and obviously he has confirmed that. So, you know, we'd rather take the time now to make sure that people are settled and not overly anxious. We can address the issues, make sure that we can demonstrate that we have control of the situation and our children are safe. And at the same time, we can address the booster shots and try to ensure that we have a broader level of support and safety implemented across the country before we move forward with you know, any degree of the original plan.
Okay. Another question is, if you know, Premier Panton, whether members of Parliament's children who are eligible to be vaccinated, whether they have all been vaccinated?
I don't know offhand.
Okay. Final question from a member of the public. Is there any consideration being given to signage outside quarantine facilities, even if it's a person's home, as a deterrent for people going to places where people are in quarantine?
I think we had a discussion around this at the last press conference. There was a discussion around effectively balancing privacy versus the usefulness of having something like that. And where we came out was, I think on balance, it was supporting privacy. And if people want to put the signs up themselves, obviously they can absolutely do that. I think even Dr. Lee noted that he puts a chain across with a sign. People can absolutely do that. I don't think that, we need to put yellow flags or something out in front of people's doors. I think if I would just encourage people to listen carefully to the rules as they have them explained to them, and to read the rules to make sure that they fully understand them. But other than that, I mean, it's obviously if you're in quarantine, it should be common sense that you shouldn't be letting someone in. There has to be clarity around the fact that you're not supposed to be engaged with anyone else. So it's not a difficult thing to, shout through a door and say, sorry, I can't open this. I'm in quarantine.
Thank you very much, Premier Panton. We're now going to go to Zoom. April Cummings from Radio Cayman is standing by. April?
Hi, everyone. A lot of the questions have been answered already, but because the signal did in and out quite a bit, sorry guys, I'm having some feedback in the room.
We need the audio.
Guys, why don't you go ahead to Wendy, because I've got to unplug myself.
Wendy, you're on standby. We're going to go to Wendy from CNS. Wendy, are you there?
Hello?
Yeah, Wendy, go ahead. We can hear you.
Okay. Thanks, Donna. Appreciate it. First of all, I just need to get some clarity on these numbers. So I need to speak with Dr. Lee. I can't see anything, so I'm not sure if you could let me know when he gets to the microphone, and then I can ask.
He is at the podium now.
Okay. Hello, Dr. Lee.
Hi, good afternoon.
Can I just clarify? From what you said at the beginning, I calculated that we had another 2 adults testing in connection with the first case, which I believe was in Northside. So that's the original case where the lady is in hospital. There were 2 new positive cases in connection with that. Is that correct?
So there were the original 2 that we knew about. Then there was
the lady and her son, yeah?
I don't think I mentioned the relationships myself.
All right, okay. Well, lady and relationship. I'm just because I'm really confused as to where we're at, and I'm trying to work it out in terms of how many community transmissions we've got. So if we had lady plus family member,
and
plus 2 more adults in connection to that.
That's correct.
Today.
Plus 2 more adults. You're correct.
Then we have 1 child at Georgetown Primary School this morning, plus 2 children today. Same school.
1 child at Georgetown Primary School yesterday, plus 2 further today that I reported just now, yes.
And then finally, an additional adult that we don't know anything about yet.
That's correct.
Okay, so that's 5 today, effectively. 5 new ones since the child.
Wendy, I've been working rather hard over the last 48 hours, and if you say that count is correct, I'm going to have to believe you.
That's what I had from the beginning.
Time is beginning to merge. So.
No, I know. It's the same thing, but that's fine. So that clears the 7 households with 7 households, 3 separate incidences. Yeah.
Okay. Yes.
Okay.
Yeah.
Okay, cool. I think the other question I have for you, Dr. Lee, or maybe Dr. Williams if he's there, I'm not sure. Is there going to be a very clear set rule about testing, quarantine, and the need for isolation? Because I think there's some confusion. I know you said we're only contact tracing immediate contacts, but once somebody if somebody's alerted that they're a contact, is there going to be a hard and fast rule about how we do this isolation? Because we don't want the situation that happened, I think, in the UK, where they literally had a pandemic where people were just being isolating. Everyone was told to go home and isolate.
I think you're describing one of the problems with the electronic systems in that they often...
they were getting pinged to go home,
They're often not very discriminatory and actually can cause confusion. And as you quite rightly pointed out, put out a lot of the UK workforce when it was absolutely not required. There is no question that the public health team understand what a primary contact means. It means somebody that has had close contact, being less than 2 meters for more than 15 minutes with somebody, or somebody that lives in the same household, or has actually had physical contact, such as a hug or a kiss, as I mentioned earlier. And only those people are considered as primary contacts. Other people who may have been in contact with a contact are secondary contacts or tertiary contacts, and they are not being required to isolate. Only primary contacts and people who are actually infected are being asked to isolate.
Okay, that makes sense. Sorry, I've got my questions in 2 different places. I apologize. Can you also just, one more thing, are we going to open the vaccination clinics for longer? Because they were closed yesterday, and I think an awful lot of people are probably wanting to get vaccinated now. So are we going to expand the vaccination clinics, or is that Monday closure hard and fast?
I think the Monday closure really reflects the demand that there has been in the past. If the demand continues to maintain high, then public health would have to consider it. You have to remember that it is the same staff that are trying to do an outbreak analysis that you're also asking to vaccinate. And there are limits to how thinly the staff can be stretched. They're doing an absolutely phenomenal job, and we'll get back to full vaccination as soon as they can. But please bear that in mind.
Okay, and finally, just do we know yet these additional cases today? Obviously, the children are not vaccinated, but these 3 additional adults, do we know whether they were vaccinated or not?
I only know of the 2 that were related to the community case that began last week, and they were both unvaccinated.
Unvaccinated. Okay, but you don't know about this 3rd adult yet.
No, I don't know. I don't have more information. I don't have further information on that person.
Okay, Dr. Lee, thank you so much. I appreciate it. That's all I have for you. My next question is for Premier Panton. Again, clarification. Mr. Premier, can you just say, when you said we're going to pause the plans to reduce the quarantine, did you say until the end of the year? Do we have a specific date that you're going to put into the regulations, or is it just an estimate that we might go to Christmas, we might go to the end of the year? Can we just get more clarity on what you're thinking?
Yeah, I think
on the date.
Yeah, thank you for the question. I think at this point, I don't want to put a specific
date on it, but that may come in the coming weeks. But at this point, I wanted to be clear to the people of the country that we were putting a pause on the plan so that we maintain phase 3, and I really just wanted to indicate that it would very likely be until the end of this year. Obviously, things could change, and it gives us the flexibility to reconsider based on all of the various factors. So we may be in a much better position, in a shorter period of time. But I would think that given the current level of anxiety and the concerns around where we're at and what we need to do, I think we're probably going to maintain that until the end of the year.
Okay, and there's no consideration at the moment to increasing the stipends or anything like that. It's going to stay at the 1,500 until the end of the year.
We haven't specifically considered that. It is, something that may be considered. I don't know, but of course we have to look at the government's financial position. I think it would be reckless of me at this point to suggest that we could, we could give that serious consideration without understanding the full context and impact from a financial perspective on the country.
Okay. Have you had chance to discuss the issue with the Cayman Islands Tourism Association in particular, and the major tourism operators have been really pressing you to open? And what kind of a response have you had?
You're talking about this current decision being communicated today? We hadn't really had the time to have a discussion. I don't know if my colleague, the Minister for Tourism, Minister Bryan, has had that opportunity, but certainly that is a conversation that will certainly happen if not tonight, by tomorrow. But clearly, I mean, what the industry have indicated to us, and I think is eminently fair, is that if we were going to not proceed, and this is outside the context of the current scenario that we've been dealing with over the past week, was that they wanted to know as soon as possible whether we were going to proceed, and I think given where we're at, coincidentally, it probably is a convenient time for them to have this communication, so that I think they know how to plan now, and they have a degree of certainty. It's not the best news that perhaps that they would have liked to have heard, but at the end of the day, they've got clarity, and the views of our government is that we are going to put the interests of people first and try to ensure that we have things under control and we can move forward in the safest fashion with the best degree of success in terms of reopening.
Okay, I appreciate that. Thank you very much. I think that's all I have for you. I just have one for the Health Minister, if Ms. Turner's there. This is really, it sort of follows on more from the question, the the public health advice that was given, the advice that was given by Public Health England, which is about having all of the necessary resources. Can we just get some understanding on where we feel that we're short when it comes to healthcare resources?
Well, it's just making sure that with this current community spread, in all honesty, we were making sure that, and we assured the community that the medical team, HSA, and memorandum of understanding with other healthcare professionals here on island, that that we are all prepared for it. Now, where public health is concerned, we realized that we had to bolster up the resources where manpower.
Right.
And just making sure we have enough hands on deck. Bearing in mind, as Dr. Lee alluded to, the same public health officers that are out there that are swabbing and testing and contact tracing are the same ones that run that clinic. And we realized in the middle of, for the beginning of this pandemic in 2020, they were up to 69 staff. And over the course of the time today, they have 83 staff, and they're actively seeking 30 more temporary staff from other departments within the healthcare facility. And I know for sure that other government departments, Travel Cayman has been assisting them as well in the past week and a half, 2 weeks. And there is a global demand for persons in the healthcare industry. So we're definitely on the ball with that and making sure that we can give them as much resources as we can. But from what we were told yesterday in that briefing of the entire Cabinet Caucus, we are an enviable jurisdiction with the high vaccination uptake, how we have handled, this pandemic thus far. We are doing very well. Now, of course, we didn't want this to happen, but it was inevitable as we eased into the reopening or trying to open our borders. So here we are. Unfortunately, we wouldn't have wanted it to happen, but it happened at a time that we can definitely test our resources and get it under control. And we're doing everything that we can in order to give them the resources that they need.
Okay, lovely. Thank you. I appreciate that. That's all I've got. Thanks, Donna.
Okay, thank you very much, Wendy. I have one other question from the public before we go to April from Radio Cayman. Will testing be open to anyone who may want to check their COVID status? This may be a question for health officials. Will testing be open to anyone who may want to check their COVID status? Can someone from Health Services Authority respond to this question? Okay, I think we have Dr. Simmons coming to answer the question.
Good evening, everyone. At this time, we're primarily focusing on the children of Georgetown Primary School. However, for those who would like to check their COVID status, we do encourage you to book with the COVID screening clinic at the HSA. And hopefully my CEO won't kill me for this as well. You can also go to the Doctors Hospital drive-through as well, their Cayman Bay outlet as well. Health City also offers that services.
Okay.
Thank you.
Thank you very much for that answer. We're now going to go to April Cummings from Radio Cayman, who is joining us via Zoom. April?
Hi, Donna. I don't want to sound frivolous, but this question I've had a couple people ask about. It's related to the Miss Cayman event and people who may have bought tickets for this event. They're just concerned about how all that's going to work. I'm not sure who that question is for. I'm assuming perhaps the tourism minister. He's still there?
Yes, he is. Hold on.
Hi, April. I apologize. I didn't get the full question. Can you repeat it again for me, please?
Certainly. I've had a couple of people ask who've purchased tickets to attend the Miss Cayman event. Now that it's going to be virtual, they're trying to figure out what's going to happen with regard to their tickets as they purchase them ahead of time.
Well, I assume, I haven't spoken to the committee chairman, but I assume that they would have to be refunded, and the government has given commitment to assist with any expenses, and if this is one of them, then we will do so. But as it is a government brand, we have to ensure that the safety is first and making sure that people are not cheated of their opportunity. But they will be able to see it online all the same.
All right, thank you very much for that. This too is a type of ticket question, although of a different nature. I had a couple of people who had purchased, they're Caymanians, but they purchased airline tickets on other airlines, and they're concerned with these changes that now they may lose their money. So for example, someone who is going to visit their child in school in the States, that sort of thing. I, even after all this, am still unclear on exactly where we are with all that. Is there someone who can address that concern for them and maybe just summarize where are we actually right now? I know the numbers of the phases, but where are we in practical purposes, for practical purposes?
Well, April, I'd be happy to give another update at another press conference, but up until yesterday, the country was, or up till today with our announcement, the situation with the airlines was pretty straightforward. The intention was that we wanted to open on the 14th. They didn't want to start any flights until around October, when it's closer to when the projected quarantine would be removed. As a result, the decision today would change the airline's business decisions, I'm assuming. So there has to be conversation. So tomorrow I'll be reaching out to the CEO of Airports Authority, who is the rep that discusses registration to come into the Cayman Islands, and see what the appetite is of the representatives for the airlines, what their intentions are. I mean, by all means, we still want people to come as long as they're vaccinated and willing to go into quarantine for the 7 days as we highlighted. So by all means, it's not that we want people to stop coming. Whether there's going to be enough supply and demand under those quarantine restrictions is up for question, and I think they will have to express whether they will want to continue under what they've said that they were going to do before. So I won't know that information until in the next couple of days, but I'm happy to give you an update if you ask me at the next press conference.
Absolutely. Thank you very much for that. I have a question. This one is from a listener who happened to be at a health clinic, women's health clinic this morning, and was concerned that there were people who had been told to isolate related to the Georgetown primary incident, but instead were in this specific area of the hospital. And so the question was really, are there plans to address this potential exposure in this specific instance?
I think Ms. Lizette.
April, I believe the CEO of the HSA is coming to address your question.
Okay, thank you very much. Sorry, I wasn't quite sure who directly to address that one to. And this is from someone who happened to be in the area at the time who sent this in.
Good evening, April. It's Lizette Yearwood here. I would need to get the specifics of that incident. However, again, we just are encouraging people when they're told to isolate, to stay at home until they're contacted by public health. I know there's been a lot of anxiety. There are individuals who just want to get tested. And as Dr. Lee explained earlier, we need to concentrate on the primary contacts right now. All of the resources need to be geared in that area. If you're contacted and asked to come forward to get tested, then you do so. But if there are multiple people who are running to the clinic to get tested just because they think that they should be tested, they're concerned, and I completely understand the anxiety, but you have to trust the public health professionals. If you're contacted and you're told that you need to be PCR tested, we will make sure that you're a priority. Individuals, I understand, may have come to the hospital to get tested in advance, but we will make sure that you're tested in the order of priority. If you have had a direct contact with the positive, you will be a priority. And if not, then you'll be contacted once those results come back. So I've been talking to multiple people today because we've had questions of all sorts of scenarios. But again, if you go back to the basics, the primary contact is somebody who has been within 6 feet of an individual for 15 minutes or more. If that individual has not been, does not meet that criteria, you are not a primary contact. And therefore, you wait to be contacted. Because then once we get the results of those individuals, if there is somebody who is a positive in that circle, we will then extend that circle to contacts of those individuals. So you have to trust the process, and I do encourage you just to be a little bit patient. I know you're concerned, but we will respond to any questions or concerns on the flu hotline. And I do need to apologize today. The flu hotline has been quite busy. There have been many calls that we have not been able to pick up, but we will be going through and responding to all of those persons who have left messages. We are in the process of staffing the flu hotline up for tonight and tomorrow because we understand that persons do have concerns. So if you have concerns, call the flu hotline, talk to a healthcare professional, go through that scenario because every one of the scenarios are different. But again, if you go back to the basics with the criteria for the primary contact, I think it will allay a number of fears, and it will probably reduce the number of people that are running to get tested. Okay?
Thank you very much.
Thank you very much. That helps a great deal. Dawn, I think those are all my questions that I can find at the moment.
Okay, thank you very much, April. We're going to wrap up with Sandra from CMR via Zoom.
Hi, Donna. Good evening. I just had a few questions that had come in. One individual wanted to know if, I guess, the cabinet members who were there, if they could speak to what members of their family, particularly their children, who are eligible for the vaccine have actually been vaccinated. I guess people are looking for all sorts of excuses not to get vaccinated. So they want to see how committed the government and by extension, their family members have been to the vaccination process.
Sandra, I asked the question of the Premier earlier. And
Sorry, I completely missed that.
Yes, and his answer was he didn't have a number.
Okay.
Yeah.
All right. Yeah, that's all I've got for you. Thank you so much.
Okay, thank you very much, Sandra. One final question. Do we have any idea when the new regs will be released or will start?
Well, we will be working on those in the next day or two. So we're going to try to get them done as quickly as possible, possibly by the end of this week.
Okay. I do have a final question that just came in. Maybe this is for Minister of Education about the policy on extracurricular sporting activities in schools. How will those, if at all, be carried out over this period?
I've been reliably informed by my chief officer that they have been postponed until further notice, till we get a grip on exactly what obtains.
Okay, thank you very much. Minister O'Connor-Connolly, any final words from the panel?
Just a
Minister of Health?
Oh, go
ahead.
No, you go ahead.
Just a gentle reminder of the vaccination clinics that are still ongoing tomorrow morning from 9 until 1 over in Cayman Brack at the Aston Ruddy Centre in the medical wing, and over in the district of East End at the health centre from 5 until 8 p.m. It is our way of just, availing. People need to avail themselves in this opportunity in getting vaccinated.
Okay.
Thank you.
Do we know when the next press briefing will be? People want to know.
Well, up until today, we had planned to have one tomorrow.
Correct.
But it depends on what transpires. But we may have one tomorrow. We'll see. If we do not plan to have one, we will certainly advise, and there will be press releases going out confirming whatever details and updating whatever details are available to us at that time.
Okay. Any final words from
the
panel?
I just want to thank my Parliamentary Secretary, Ms. Catherine Wilkes, and certainly Chief Officer Cacho, and the rest of the team that worked into the wee hours of this morning and continue to show their commitment to the education for students here in Cayman.
Thank you very much. Thank you to the public and of course the media for joining us today, and of course to our esteemed panelists for providing us with this very informative session here in the press briefing. Remember, you can watch the entire press briefing on demand on the CIG Television YouTube channel. Also, you have gov.ky and hsa.ky, the places where you can go to find out the vaccination schedules as well as information on COVID-19. Until next time, everyone, enjoy your evening.